My name is Patti Wong. I'm a practicing otolaryngologist, which is another word for an ENT surgeon. I've been practicing in Frisco, Texas for about 5 years, and I practiced previously in Austin, Texas for about 10 years. I've been practicing for over 15 years. So I developed this app after talking with my niece, Leslie. She is a family practice physician in New York. She had been telling me that she had been looking for an application to help with Chinese medical translations. Even though she is fluent in Chinese, she was having difficulty with finding an app to help her specifically with medicine. And from that, I decided to work on this app mainly for Chinese, but then I also realized living in Texas that there would be a huge need absolutely to help with Spanish as well. When I first thought of the app, I decided to try to develop a list of phrases that would be used in the office. However, as the app became more and more involved, I realized that we needed to include many phrases so that it would really be universal across all specialties and across all healthcare providers. And from there, we also decided to develop audio to actually facilitate the patient-physician or patient-medical provider relationship.
I'm Dr. Jolie Bailey. I'm an anesthesiologist in private practice in Dallas, Texas. I would say that in my practice, certainly at least once a week, I run into instances where I have a non-English speaking patient who speaks Spanish, and I require some sort of fast medical translation application. And then probably about once every month or two, I run into a patient who speaks Mandarin, or even Mandarin plus another dialect, who I require a medical application to translate my preoperative interview with them. I think one thing that's very special about the Dr. Patti medical translation application is that you can ask very specific things. You don't have to input your information that you're seeking in a very limited and scripted way. One great thing that gives me confidence is that it was written and double-checked and triple-checked and quadruple-checked by an actual physician. It wasn't written by someone who was marketing and knew the language but didn't know medicine. It's actually written by Dr. Patti herself, who's a practicing physician in my community, in fact, and so I know that she's gone through it to make sure that the questions are real and important and clinically relevant.
As far as developing the app, I wanted to make sure that any individual could actually use the app. Initially, I had envisioned this app to help mostly physicians in their relationships with patients. However, I realized that office staff, receptionists, nurses, medical assistants, ER staff would all be able to benefit from this app as well. And as we extend the use of this app, it's very possible that family members can also use this app to help with communication with their providers. One of the things that I think is really nice is the search function. There are so many ways to say a certain phrase, such as dizziness. But in other apps, you actually have to type in the word dizziness to find those phrases that have dizziness. But with ours, you can type in disequilibrium, imbalance, spinning of the room, motion sickness, so it really makes it more universal from that standpoint. Another nice feature is a favorite section. So I have friends that are just anesthesiologists or nurses, pediatricians, where they can save their favorite phrases that they use all the time into a favorites list. One of the things that I noticed was missing from other Mandarin apps was the addition of pinyin. It is basically the English alphabet of the Chinese characters. So we added that feature to our app. And probably the most important thing is if anyone needs extra phrases made, definitely you can just email me and we will add those to the program. It was so important for me to get this right and you all have confidence in it that I would have my day in surgery or day in the office. I would come home, take care of the kids, get them ready to bed, and then I would start working on my app. And sometimes this would not even be until midnight. I would go over each phrase and think of multiple ways to say it or write it. And if something didn't just seem right, we did it over again until it was right. I would email my translators, my developers, just to make sure that we had everything the way we wanted it to. It ended up being just a family affair. What was originally slated to be a 3-month project ended up being over 1 year because I wanted to make sure there were multiple phrases and more importantly, flexibility. I wanted the audio to be correct, and I refused to cut any corners. I hope you enjoyed this. Please email me with any feedback. I really enjoyed making this myself. And thank you so much. Gracias.